Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking about the changes that are anticipated with McLaren Port Huron's campus. And in this segment, we're going to be talking with Vice President of Operations, Dave McEwen. Dave, welcome back to Today's Health.
Thank you, Barbara.
Now, I understand that the Board of Trustees unanimously approved a large construction and renovation to the McLaren Port Huron campus. What kind of changes can I expect to see?
Well, it's first of all, it's very exciting, and not just to have our board approve it, but the McLaren corporate board as well enthusiastically endorse the project. This is a culmination of years of thought, and it will bring to us and to this community a Karmanos Cancer Institute, a new patient tower, and renovations that will affect and improve our patients' experience throughout the hospital.
What's it going to look like?
Good question. We will be constructing a cancer center that will attach to the north end of the hospital, where the existing emergency center is now. And that will be a two-story structure, taking advantage of the views across the Pine Grove and out onto the park. And the tower will be attached to the south end of the hospital, literally connected to the Wismer Health Center, so that the floors marry up. In particular, we want the surgical facilities to be adjacent to each other, the existing and the new. And then the renovations, which will be the last piece of the puzzle, will largely be seen in the hospital's current east tower, so that when we're through, we'll have 100% private rooms, all renovated, either new or newly renovated. That we think will just be a wonderful feature for our patients and our staff.
Now, you have a picture here, so can you kind of, we gave you a pointer, can you kind of walk us through here?
This is Pine Grove here. This is as if you're in the air looking northwest. The existing main entrance, it's disguised, but it's right in this elbow of the hospital. The emergency center is here. The Wismer Health Center is here. So the cancer center, the feedback we received from our physicians in particular was that it should be connected to the hospital, because occasionally our inpatients will require service in that facility. So we've attached it at the north end to the emergency center. And then shortly after the cancer center is complete, we will occupy the south tower, which is this angular structure here on the south end. The emergency center moves into the first floor of the new tower, and at that point the cancer center expands into the space that's now occupied by the emergency center.
And then the patient tower, tell me about that.
We don't know yet if it'll be a 4 or 5-story structure. We're looking at the costs associated with a smaller footprint and a taller building, larger footprint, shorter building. But we quickly established, in addition to meeting our infrastructure needs, some parts of the hospital are 83 years old, we really wanted to improve the patient's experience. So we quickly agreed around some specific clinical needs that we had. We wanted a new emergency room that was larger. We need a new intensive care unit that's larger. We wanted to build new inpatient operating rooms, new cath labs for the cardiologists, and then either 2 or 3 floors of new patient rooms. So that's how we reach 100% private rooms when we're complete.
How did you develop this plan? It's comprehensive.
We've taken a couple runs at this. In the past, the most recent one was in 2009, 2010. And of course, with healthcare reform evolving at that time, we just didn't have the confidence. The industry was not predictable in terms of what hospitals and doctors were going to be paid when this was all done. But joining McLaren really gave us the confidence and the clarity and the strength to pursue this plan. So we dusted off that plan. We developed a new design team, very experienced design team with experience throughout the country. And they came together and brought us into coalescing around some key features. In addition to the infrastructure updates, the mechanical systems, electrical, ventilation systems, that's the group that really helped us focus on patient rooms, operating rooms, emergency rooms, intensive care units, and the cardiac interventional platform services, the cardiac cath labs.
So now these are people that have done this before in other places, but then how do you involve the community and the current staff?
That's a good point. We have a very experienced design team. The architectural firms, we're actually using 2 architectural firms. One's the largest architectural firm in the country, Smith Group. They're based in Detroit. The second is RTKL, based in Chicago, who is one of the largest design teams for cancer centers in the country. They bring that experience to the table. They've designed everything we want before, hundreds of times. But they also helped us develop a model where we invited in folks from the community, our medical team, our clinical leaders in the hospital, previous patients in some cases. And that helped to inform the design process early on, so that we had an appreciation for how the community could experience a new facility like this.
What's your timeline for all of this?
Sure, it's about a 3-year project, but the community will see immediately some activity when we break ground this summer for the Karmanos Cancer Institute. We will also break ground later this fall for the new tower. The Cancer Center, the Karmanos Cancer Institute, will be open spring of 2016, and at that point it will be providing everything associated with our Karmanos Cancer Institute, clinical protocols, research capabilities, radiation therapy, infusion services, medical oncology, spring of 2016. And then we continue to move. Spring of 2017, the tower will open, and that gives us the opportunity to have a new home for our emergency center that allows the Cancer Center to expand a little further. Winter of 2017, the Cancer Center has even more space available to it and for the community's use. And then we move into some renovations, and about a year later, fall of 2018, the project should be done.
Thank you so much for joining us.
Well, thank you, Barbara.
Stay with us. We'll be right back with lots more information.